So today we're going to demonstrate the Spirox LATERA implant for the treatment of lateral nasal wall insufficiency. Our patient has a history of nasal obstruction and with some associated septal deviation and turbinate hypertrophy, but we noted on examination in the clinic that there was some lateral wall insufficiency as well. To see that, we did a modified Cottle maneuver, and I want to demonstrate that here today as well. So I'm going to have you take a deep breath in and out through your nose. Good. Do that one more time. I'm going to put a little pressure inside your nose, and we're very lightly applying the cerumen loop onto the sidewall. We don't want to displace the sidewall. Go ahead and take a breath in. Do you notice any improvement with that?
Yeah.
Let's try that on the other side. Is that better?
Even better on that side.
We don't want to put too much pressure so that we're displacing the sidewall off to the side, because the implant isn't going to be able to do anything like that. But it is going to be able to support that sidewall. And so when we place the cerumen loop in the nose, we're just gently supporting it to allow it to keep it from collapsing down. So the first step that we want to do is we want to use our planning tool, and we're going to use this to actually show where the implant is going to be placed. So I had my point from pre-op that I made right above the alar crease, and we're going to place the implant about halfway up the nasal dorsum. Now if a patient wore glasses, we would probably want to try to move it away from where the foot of the glasses will sit. In her case, she does not wear glasses, so we're going to be able to place it about halfway up. So we'll go ahead and get our marking pen. We're going to mark out our distal point. And our proximal point's already marked by where we mark things preoperatively. Now one other mark that I like to do is I like to continue this line all the way out to the margin, the alar margin, to give myself the point where I'm going to puncture the nasal vestibule. So if I continue this as a straight line coming out, we see that it's approximately right here, and that'll be the point where we puncture to place the implant. So an important consideration here with the placement of the implant is we do want these forks to be over the nasal bone. So we want to be sure that there's a good component here resting on the nasal bone. A second consideration is we don't want this proximal point to be below the alar crease here. That tends to be a point where the skin gets very, very thin, so we want to come above the alar crease, and we want to get the distal point on the nasal bone. So we're going to do a little injection of lidocaine and epinephrine. It's important that we have marked out the position of the implant with our planning tool prior to doing the injection, because it will distort the anatomy a fair bit. So this is the LATERA delivery device, and we're going to go ahead and load it. We push this button to pull back the device. You'll see the push rod come back, allowing us to place the implant into this little channel right here. So this is our implant here, and we're going to drop it into the little chamber and make sure that it falls down and rests in there well. And now we're going to go ahead and push this until we hear a click. So now we're going to go ahead and place the implant. And the first thing we want to do is use our double hook to evert the nasal vestibule a little bit. Now we're doing this in the nasal vestibular margin. And we're going to point our bevel toward the septum, and we're actually going to point the whole delivery device toward the septum as we're entering here. And as we get it through the nasal vestibular skin, we're starting to retract with our double prong skin hook, and we're starting to dissect with our device into that supraperitoneal plane. And I like to keep a fair bit of tension. And I palpate intermittently to feel where the end of my device is located. And I can feel it now right at that distal tip there. We can take our double prong skin hook away. Let's pull it down tight. And we're in a good position right here. I feel very good about that. We're going to orient these two prongs in the same relationship as the nasal bones. So now we're going to go ahead and support our device. So it's important when you are placing the implant and you're getting ready to push that deploy button not to put extra force on it. And as the implant deploys, not to put extra force either. And we're going to push this button here and we're going to deploy the implant. Now I like to put my finger over this distal hole now that the implant is deployed, and I'm just grabbing the two prongs of the implant here with my finger, and I pull straight back. Now we're going to go ahead and look to make sure we don't have any implant exposure, and I feel that area as well, and it feels very good.